Welcome back to Inside South Florida. As your kids get set to head back to school, here are some safety tips and nutrition tips too from Dr. Jose Vidal. Dr. Badal, good to have you. Thank you for dressing up. You look great.
Yeah? Thank you for having me here.
It's our pleasure. This is the standard sort of apparel for what you do for a living.
Absolutely.
Yeah.
Well, that's what I see. I see kids, and this is what they like.
Yeah, of course.
This is what they like.
So you and I were just talking a moment ago before we started the interview. So with kids getting back to school very soon, you see a lot of kids that come in because they didn't eat a proper breakfast, and then they collapse or whatever, get lightheaded at school.
Absolutely, and that's a main concern because they are not. Actually, you could hurt your head because you fall down, and other things. We get a chance to see them.
Yeah.
And the majority of times, that's probably one of our biggest complaints, and they usually come in by ambulance.
Wow.
So this is any child that could be at any age, but usually it's more in the age of 10 to greater.
Okay.
And I don't know why. I guess it's because these kids just run out of the house. They don't, their breakfast isn't packed for them.
You know why? Because they're so excited to get to school and learn. That must be what it is.
Probably.
Right, I'm sure that's what it is. So let's start with breakfast, okay? You mentioned that a little bit. Let's talk a little bit more about that. What do parents need to make sure their kids are eating for breakfast?
Very simple. Nice glass of orange juice. A cup of milk with chocolate.
Really? Chocolate in the morning?
Absolutely.
Okay.
That has a nice sugar.
Okay.
And cereal, quick snack. And that's pretty much it.
Yeah, so it's most important that they're eating something, right?
Absolutely. Especially, remember, you go that period of night that you go to sleep probably at 9 or 10. For those 12 hours, actually like 10 hours.
Right, nothing.
Nothing.
Yeah, sure. Yeah.
So that's a very important part.
All right, so while we're sticking on the food train of thought, school lunches, okay? I remember tater tot Tuesdays and tacos and pizza and stuff.
No, they're making it a little bit better.
Yeah, it's gotten healthier.
Absolutely,
Right.
because for like 50 to 60% of our children are overweight.
Right.
So they're actually making it a lot more healthier.
So let me ask you this then. All right, so is there anything a parent should tell the kid? I get it's largely up to the school, but let's say a parent makes lunch for their kid, like a bag lunch. Well, what should a child be having for lunch?
Could have a nice bread with maybe some mayonnaise, some ham, some cheese.
You're the best doctor ever. Mayo, chocolate milk, cheese. I thought you were going to say, broccoli and carrots for 3 meals a day.
No. Just something basic, small.
Okay.
And as long as they're eating something within that 3 to 4 hour period, because then it comes the activities that come through running through classes and maybe the PE or the gym.
Right.
That's what we used to call it.
Right, PE, yeah. You mentioned, before we started the interview, you mentioned vaccinations, and that was a big deal too, yeah.
Yeah, that's more up for the pediatricians.
Right.
Most of the kids are seen, but when they reach to an age about 5, their vaccinations are done. They have to wait till they're 11, and then the 12 and 13 and 4. So that time period, there's gonna be a lot of students or kids that have their vaccinations, but when that time period, 11 and 12, they need to go back.
Okay. We have a couple minutes left. I want to ask you more of a mental than a physical one, anxiety, like cyberbullying or just generalized anxiety about going back to school. What are some things you might want to tell parents to look out for regarding kids with that?
Just the way they act, how they're dressed, the mood to go to school. My tummy hurts. I got chest pain. I can't make it tomorrow. And those are addressed directly by the physician or they come to me. And that's how they present, with functional complaints.
All right, well, the one thing I take from all this interview is homeschool everybody. That's
No.
Just kidding.
No.
Just kidding.
No. We used to do that many years ago.
Yeah.
No,
school can be a great thing as long as you just sort of be aware and present and eat well and all that stuff. Right?
And you need it. You need the socialization of school.
Yes, right.
For that.
As we say goodbye, is there a website or a phone number if people want to ask you questions or anything like that?
No, not really. I think the most important thing is just address it with your primary physicians, your pediatricians, and the ones that you are familiar with, and they require it. You can't be in school if you're not properly vaccinated.
Okay, get to it. Dr. Badal, good to meet you. And,
great.
Next time, Superman, maybe.
Well, we'll stick
Avengers,
with...
I don't know.
We'll probably go with Thor next
Thor!
time.
Oh, of course, who doesn't love Thor? All right, great to see you.
Thank you.
You've got it.